complicated. And it is getting more complicated, particularly in the older population. Number one risk to the brain of diabetes is not diabetes. It's the treatment of diabetes. Okay? So when we treat people with insulin or medications that increase insulin, that reduce blood sugar, if we overshoot the mark and we lower someone's blood sugar too much, okay, high blood sugars cause us to be drowsy, may increase vascular disease or blood vessel problems, but our brains, our neurons require sugar. If we take sugar away from our cells completely, the cells die. Hypoglycemia, a low blood sugar, kills brain cells. And so aggressive treatment, especially in older people with diabetes, is fraught with risks. And interestingly, in the last few years, there have been a number of studies that have been looking at aggressively treating diabetes, and they've been finding that maybe we don't want to be too aggressive. They've studied this in folks in the ICU, they've studied this in the outpatient setting. So I tend to be more cautious with my patients with their diabetes, not to over-treat it, because a single episode of a blood sugar of 0 is going to be far more detrimental than a couple weeks of a mildly elevated blood sugar, or a month, or a year. Okay? And basically, you're causing a stroke when you bring the blood sugar down to 0.